Item 34 de la legislatura en Guahan is called to order. Mr. Majority Leader.
Thank you, Mr. Speaker. Mr. Speaker, I move to adopt today's legislative session agenda dated February 22nd, 2018.
The motion has been made to adopt today's legislative session agenda. Are there any objections? Hearing none. Senator Torres, would you please lead us in prayer? And please rise and we'll do the national anthem. Send them when you Guam hymns.
Kinaani tata ilahinu tani Espiritu Santo. Maila zatafana na tutu. Tu ustata ni toro hanat sinya. Hua fresi graciamo. Sa maka di problema ni eslata pago. Zan mapu di tetu mami gwinigi legislatura. Na iham asay animo zan pasensya. Na siguro ihinason mami. Kosa kita fanabansa mo na iminaulik mo. Para iminaulik itaw-tauta. Heavenly Father, from whom all things are possible, I ask for your graces, because the problems of our island are heavy, and our jobs here at the legislature are heavy. Give us, dear Lord, the strength and patience. Make our decisions certain, so that we can advance your goodness for the good of our island. In Jesus' name we pray. Amen.
In recognition of the recipient, the Mindalazan Mastakala and the Sacrificio, Senator Lee, you're recognized.
On behalf of a grateful island and country, we honor Macinus Mate 3rd Class Vicente A. Champaco and the family of Macinus Mate 3rd Class Vicente A. Champaco for making the ultimate sacrifice in service and in defense of our island and country.
For the Nefresi, Senator Lee, would you please lead us?
In Nefresi, Gininimas chakalo, gina soko, imas chakalum, gikurasonhu, zanimas figu, neninasenyahu, hu fresin maisadzu, parabai pratahi, zani defendi, ihinengi, ikutura, ilingwahi, airi, hanum, zanitanu tamoru. Niren shaku diretu dinas druasata, esti hua fitma, gihilui biblia, zani benderahu, ibenderan guahan.
For the hymns, send them when you would, please. Will the clerk please take roll?
Senator Ada, Senator Uggan, Senator Castro, Speaker Cruz, Senator Espadon, Senator Esteves, Senator Lee, Senator Morrison, Senator Munoz, Senator Nelson, Senator Rodriguez, Senator San Agustin, Senator San Nicolas, Vice Speaker Chalahi, Senator Torres. Mr. Speaker, there is a quorum.
Thank you. Mr. Majority Leader.
Thank you, Mr. Speaker. I move to waive legislative session agenda items 8 through 10.
Motion's been made to waive items 8 through 10. Any objections? Hearing none.
Mr. Speaker, there are reports of standing committees, and I move that they also be appended to today's session journal.
On the motion that reports of standing committees be appended to today's legislative journal, hearing no objection.
Mr. Speaker, I move to waive legislative session agenda items 12 and 13.
On that motion, any objection?
So we should go right into the second reading now.
Yes, I guess we are in second reading at this point. There is only one item on the agenda for this afternoon. Excuse me.
Speaker Cruz, you are recognized.
Thank you very much, Madam Speaker. Madam Speaker, there is only one item on the agenda for today, and that's Bill 245 COR, as introduced by the Committee on Rules at the request of the Governor. I'd ask that that be placed in third reading.
Is your microphone working?
Thank you very much, Madam Speaker. Again, there's only one item on the agenda, and it is Bill 245, and I'd ask that be placed on third reading, and I'd ask for an opportunity to speak. Thank you very much, Madam Speaker. Madam Speaker, I want to thank all of you here who sat with me through 9 hours of hearings yesterday. And I want to especially thank my staff for having stayed after we all left at 8 o'clock last night to complete the committee report that you all have, and I believe has been placed online. The committee report for Bill 245 has been uploaded onto the legislative website and is it is online. So there is only one item before us, and I have a number of amendments that I want to make, but I'd like to have everybody first have an opportunity to speak as to how they feel about the bill, so I'd understand about which amendments I should move forward on. All right. If that's possible, if I could ask to come back on after I hear from other members of the legislature, so I know whether or not what amendments I can and should make. Would that be possible, Madam Speaker?
I guess we'll just hold off on the amendments until your closing. And so, is there anyone else who would like to speak on the bill? Bill 245?
Thank you, Madam Speaker. Madam Speaker, I understand that there may be, as the previous speaker mentioned, there may be potential amendments to this measure. And I would like to make a request that we go into the committee of the whole, and also if we could discuss these amendments within the committee of the whole, if that's possible.
Is that a motion?
Yes, Madam Speaker.
There's a motion to go into committee of the whole. All in favor? Or is there any objection? There's an objection. So all in favor, please raise your hand. Motion passes. So we'll take a 5-minute recess to set up for committee of the whole.
The Committee of the Whole is called to order. I want to thank the members of the administration that have come to assist us in deliberations this afternoon. Again, I want to thank all my colleagues for having sat with me yesterday for 9 hours of hearings. And I again want to thank my staff for staying after we all left at 8 o'clock to complete the committee report, which is contained and is online. The committee has decided to report only one bill out, and that's Bill 245. It was evident from the testimony that was given yesterday that 244 had no support. So 245 is before the body at this point. There's been a request for the Committee of the Whole, and so I will entertain any questions of the panel that's here. There are representatives, the Director and Deputy of Department of Administration's here, Mr. Byrne and Mr. Ariola. Mr. Carlson's here from BBMR. Mr. Camacho's here from Rev & Tax. The hospital is represented by their medical director, Dr. Duenas, Ms. Benita Manglonia, their CFO, and Mr. Kando, their facilities manager, and the chairman of the Board of Education is with us also. So I will allow any questions to be asked, or if anybody wishes to make an opening statement, you have the floor, can be recognized. Anyone have any questions? Senator Morrison, you made the request of the...
Thank you, Mr. Chairman. I want to thank the administration. Thank you, Mr. Chairman. I want to thank the body, or my colleagues here, for being open to this request of the Committee of the Whole. And I thank you, Mr. Speaker, for the proceedings yesterday with the hearings. And I know some of my colleagues had some questions or had more questions for our administration officials, but I understand you were doing your best to balance time and allow for our public to provide testimony as well. And I certainly, this allows us, if we have any additional questions or concerns, to have cleared up at this time. So I thank you, Mr. Speaker. And yesterday, I did bring up the issue shared in Section 3, the effective date of the increased BPT, and it was my understanding that so that we're on the same page, that to move forward with an amendment that will be very specific to the timeline. And I know there was also mention that that will work with a timeline of April 1st. The administration proposed that we move that timeline up to March 1st. And I have with me, Mr. Chairman, and I don't know if the officials want to comment to me, but willing to proffer this amendment, but I want to ensure that we are on the same page, that this March 1st deadline or timeline is workable. Understanding that this is in a couple of weeks.
Yeah, thank you, Senator Morrison. Thank you, Mr. Speaker. It really would facilitate the process that we're trying to collectively address here today if we could define, I think, is what Senator Morrison brought up yesterday more clearly, the section, because I believe it says to commence immediately upon enactment, but he was looking for a more definitive start date, and March 1st really would be more advantageous to be able to address the fiscal needs that we're all collectively trying to address here.
Yes, thank you, Mr. Chairman. And thank you, Mr. Carson, for that. I also want to be very clear again that we're on the same page with regards to same section, section 3, during the sunset period, that there was some agreement or discussion at the public hearing that instead of being very specific on what items we want it back or what items we'll be working on during this sunset period, that the administration and the colleagues were possibly open to within 45 days to report back to this body these items that clearly would be identified so that we know, at least our public knows, our people know what within this time frame we will be working on. Because as I read it right now, it's kind of just very general, or it's kind of vague and not sure. I know there's discussion at SES, but at least even at that, to report back to the SES within 45 days, what items, very specific, that we'll be working on. I know there's been a lot of discussion, Mr. Chairman, but I think it's very important that we know what exactly we were going to work on within these 2 years, within the sunset period. And I have an amendment, and I wanted to make sure that that we're on the same page, that if 45 days is ample time to provide these items back to the SES or to this committee, to this body, to ensure that we know exactly what are those items we'll be working on.
Senator Morrison, just so I get it clear, you're talking about two different things, are you?
Yes, my question was answered regarding
Okay.
the first item. I am
And so
actually moving on to
You're referring now to page 8B about during that 2-year period.
Yes, sir. That's right, Mr. Chairman. And again, I know I brought this up, but I really want to make sure if we do move this amendment, that 45 days to ensure with our public that there was be a report back to the SES or to this committee or to the committee that we know exactly what we are going to be working on within this two-year sunset period. It's 45 days. Mr. Carson, you mentioned, is it possible to move that up, or?
Thank you again, Senator Morrison. I really did get a lot of comfort and ideas working with the SES. The Office of the Public Auditor is there. She has a variety of ideas that she discussed the last couple SES meetings. In her audits, and using her audits possibly as guidance for implementation. I thought that would be a great forum to be able to use as a group that would be tasked collectively to do this. So you'd have the representation of the administration, the legislature, specifically the Office of Finance and Budget as well. You have economists, you have GVB. It's a wide and varied group of experienced people that I think would help provide and report back to the legislature a bunch of different ideas that we could be working on with your support after the report to meet the sunset clause. We spoke about the sales tax and the timing and the barcoding, and I really don't know how long it takes to be able to change how much a product costs when you scan it, particularly when a company has tens of thousands of items like a supermarket, right? But I also mentioned yesterday that the mom and pops might need some more time to be doing certain things as it relates to sales tax and differentiating. If we added a 2% sales tax on top of a BPT, how do you differentiate that amount of money that's supposed to go to the BPT account versus the sales tax account? So the group that I would suggest that the amendment, if you're looking to make one, Senator Morrison, would be to task the Special Economic Service to meet and as a group come up with a report, in the timeline that we were discussing yesterday, to help ensure that there's going to be movement along with this process.
Madam Speaker, Madam
Yes.
Chairman,
Senator Cruz. Speaker Cruz.
just on that point, and I don't want to be contentious today, and I'm sorry if it's going to sound that way, but the SES can only be effective if the administrative agency, the executive agencies, would respond and provide us with the needed information. In December, as Senator St. Nicholas pointed out yesterday, a year ago December, his tax commission had talked about the fact that we've got to address this Trump tax. We've been at this talking about it for 15 months. This December, in trying to determine what the Trump tax the effect it was going to have, I wrote to Revenue Tax and I asked them to break down each one of the areas, the taxpayer rates, so that OFB could come up with an amount. When the Trump tax was actually passed, my OFB director called out to some government agencies that were willing to respond to give him actual information on what their first remittances under the new Trump tax the effect was. And we got some from a couple of agencies, but I hate to say this, but we didn't get a response back from Department of Administration. Thankfully, during SES, he did admit that the remittance from with withholding had gone down 20% from the general government. But that should have been provided to, I don't know why that wasn't provided to us when my OFB director called and asked for that information. Senator Morrison is correct in asking how much time do you need to be able to do things. I know personally, because I've seen the email chains, that Revenue Tax has been talking to individuals about the online and the B&Bs since last July. And they can dispute me if they want, and I will show them the email chain that was provided to me. When are they going to do something about it so that we know what we're going to be able to do? I'm willing to call SES every week if the administration agencies would respond to my SES office requests.
Senator Morrison.
Thank you, Madam Speaker, Madam Chair. If anyone my colleagues have any more questions along these lines, I do have other questions, maybe specific to the hospital and DOA, but if my colleagues have any questions along these lines, I'm could come back.
Is there anyone? Senator Morrison, please continue.
There's been mention of cost containment, cost reduction measures that have been put in place, and for the body, whoever could respond to this. I mean, we do hope we can get more specific on this. What type of realized savings are we anticipating throughout the year? I know there has been a circular that has gone out to all the agencies, but at this time and date, do we have an anticipated savings that we're looking at by the end of this fiscal year? If anyone could respond to that.
The echo's really bad, or the acoustics, but can you just say it again and one more time?
Okay,
the question.
No, there was mention of cost containment that's in the works, or cost reductions. I just want more specifics. I mean, I know there's a circular that went out to all the line agencies, and I'm sure that the administration might have some information and anticipating what type of savings we'll be realizing by the end of this fiscal year, should all those measures be put in place with all the line agencies. I know one of my colleagues has been talking along those lines, and I wanted to see if the administration is already anticipating these savings, and if you can be more specific.
Mr. Carlson.
Yeah. Thank you, Senator Morrison. Yes, the circular went out and reinforced a previous executive order. So we do anticipate that we will start seeing reductions in power consumption and operational costs that are outlined in Executive Order 2012-01. And we will continue to monitor those reductions to ensure that people are complying and that everybody is doing their part to be able to reduce everything that we can. I believe the video yesterday even spoke about the elimination of single-sided copying and things of that nature. Everything adds up. So we will be monitoring that. The circular went out in February, the first part of February, if I remember correctly. So we don't have any data to be able to provide, but we're serious about doing this, and we'll keep on top of it.
Thank you.
If I can add to that, Senator, also, at GSA, the Chief Procurement Officer has been instructed to review every single requisition coming in, requesting a purchase order for any types of purchases. Only critical purchases or requisitions are being pushed through. On the human resources side, we're holding and halting all personnel actions with, of course, public safety, public health, and things of that nature. Anything that's really critical. Anything that's revenue generating, positions that are revenue generating, of course, we're taking that on a case-by-case basis. Of course, assuming it goes through BBMR as well. Internally at DOA, we're looking at all our contracts to include Xerox copiers, everything down at OTEC, all our whatever software contracts that we have that we can cut. We're doing everything we can. I can tell you that within DOA as well. But in the government as a whole, we're holding back on as many requisitions that are not critical, and as well as on the human resources side.
Senator Warren, Speaker Cruz has a follow-up. Is that all right? Speaker Cruz?
Thank you very much, Madam Chairman. Madam Chairman, I think what the good senator is referring to is in discussions this morning, one of our colleagues from Manilao asked a question about is there a fiscal realignment plan? And there is under statute. And I think more specifically, the question should be asked, pursuant to Section 4109F, Chapter 4, Title 5 of the Guam Code annotated, entitled the Fiscal Realignment Plan, 30 days after the close of each quarter of the fiscal year, the directors of the Department of Administration, the Department of Revenue and Taxation, the Bureau of Budget, Management and Research shall determine whether actual revenues collected for that quarter are consistent with the projected revenues of the fiscal year. If said directors determine that projected fiscal year revenues based on actual revenues collected are 3% or more less than revenues projection adopted by the Annual Budget Act, Imagat Lahin Guahan shall submit to the Speaker of Legislature Guahan a fiscal realignment plan which shall address the revenue disparity. Said plan may include, but is not limited to, cost containment and austerity measures, governmental reorganization plans, and other such actions. Imagat Lahi shall submit to the Speaker of Legislature Guahan proposed legislation in a bill format to implement the fiscal realignment plan if legislative action is required. That really is the question. And according to the CRER, which was released the other day, I'm not sure if they're going to get around it and say it's not official or it's a draft because it's only signed by one director and not all three, which I'll get to in a second. According to the CRER, yes, Lester, the one that you transmitted is only signed by, oh, no, it is all signed by all three of you, I'm sorry. The one that was sent over the email only came with one signature last night. But all three, they've admitted that the deficit for the quarter and the projected deficit for the year is greater than 3%. For the quarter, it's 3.7. For the year, it's 4.39, and that's even before we've addressed these two acts. I mean, Bill 435. So, is there a fiscal realignment plan pursuant to 4109? And when can we expect the bill, or is a bill necessary to implement the cost containment measures that are being considered?
Mr. Carlson.
Thank you very much, Mr. Speaker. Yes, the CRER does show that given the revisions that we made internally to the tracking, given the reductions that we collectively agreed to in the SES, we are now tracking 4.39% for the year below. The fiscal realignment plan is a requirement. I would submit for the Speaker that we transmitted that on the afternoon of the 20th. We were in session yesterday. Today's the 22nd. We do intend to memorialize everything that we're doing in a more format consistent with the mandates in law. I hope you will all understand that we did have some meetings. We did know that this was coming. We did collectively agree on a revenue shortfall number. BBMR did send out 2 circulars. So the groundwork has been laid to be able to begin this on a more formal process, and you will see something within the mandated time frame.
Mr. Speaker, did you have a follow-up to that?
Will any of those things require legislation from us so that we know whether or not we should be addressing those?
I believe some of the efforts that we're going to need, especially maybe today, I think I'm going to ask this body for consideration of giving the governor greater transfer authority so that we can manage through the times that we're in a more efficient manner. That's what I would ask to be included today. But should we deliberate, discuss, and pass the measure before you, as written, I think that'll take the edge off of a lot of what it is that we have to do. But I still think that it's only incumbent upon ourselves to follow up with this body in parallel in the implementation of the government revenue streams, cost containment measures, and other cost-saving measures that we began this discussion talking about. I think those should run in parallel.
So, according to the CRER, the quarter is short 11,132,988, or 3.7, and you're projecting for the year $278,179 as a shortfall for the entire year. If Bill 245 passes as is, will that obviate or make unnecessary the need to go through a fiscal realignment plan?
It'll help, sir. It'll help, but I don't think that we should not embark upon the effort. I think it'll shore up revenues. I think the next CRER, given the implementation of the Tax Cuts and Jobs Act and the already evident transition of withholding taxes into the pockets of wage earners and out of the government coffers, and then the payment of corporate estimated taxes, and then the March payment that's going to be due. We are going to get property tax, but it's just the first installment. So it's going to help, but I don't think it's going to, and nor should it absolve the responsibility, given the fact that by statute, once we hit that magic number, and we did hit it, that we at least take the steps that are required.
And if the bill passes as is, the 1% that's going to go to general governmental operations for the remainder of the fiscal year, how much are we anticipating that would be? If the start date is March or the start date is April, how much would that bring in by the end of the fiscal year for the general fund? Not the one going to education or to the other 1% that's going to education and the hospital.
The information before me is 1% with a start date of April would be 24.63 million. That's April.
And how about if it was March?
If it was March, as I mentioned yesterday, I'm thinking it'd be closer to 30.
And your projected shortfall for the year is 37. I think some of my colleagues, and especially myself, and some of my colleagues were wondering, what assurances do we have that if Bill 245 is passed as is, and you get that 1%, you get that 24 million, or you get that 30 million during this fiscal year, that you just don't decide, it's the end of the administration anyway, we're not going to go through with any of these reductions. Why suffer the last several months, and let's just eat and be merry without any kind of sacrifice, any fasting?
Sir, with all due respect, I think the professionals up here hold ourselves, and we come here to work with you. And we would like to end this fiscal year in the same fashion that we believe that we ended last fiscal year, in a surplus. We'd like to be able to go out with our heads held high. We'd like to be able to set the stage for the next governor and the legislature that will also be impaneled. We'd like to set the stage for our island, for our health community, for our Department of Education, for everything that we have in this bill, so that Guam is a better place. And I, for one, and I'm sure Mr. Arreola, Mr. Byrne, Mr. Camacho, and our colleagues over here from the Department of Education and from the hospital share my sentiment. So, sir, our guard will not be let down. We have the people to answer to as well, and it would be something that is against our nature to just say, oh, thank you very much, see you later. That's not how we roll.
I'm sorry I interrupted Senator Morrison, Madam Chairman, but I just wanted to follow up closely with the questions that he was asking to make sure that all of you are clear about what the fiscal realignment plan is and what that provision requires. And the statement that is, because I know that some of you asked me the question, what are they going to do? And all of you received the presentation that Mr. Carlson provided yesterday of the savings that were going to happen and whether or not those are going to follow through, and what you guys can ask your questions later on whether or not you're going to be satisfied that that presentation will actually be followed through. DOE has been going out and hearing its constituents and whether or not they can cut some. And it's showing that if when push comes to shove, we can start finding the notches in our belt to pull it a little tighter. But as long as we don't have to, just be comfortable. And so I really do hope that everybody follows through and makes sure. But my only concern was that the Trump tax passed, and we knew since the first of the year that there was going to be a drastic drop in revenue, but the executive budget request that came through was an increase over last year's budget. And the most recent press release within the last 30 minutes out of the administration is,
sir,
we're at bare bones already.
Point of clarification, that wasn't even correct.
You can finish, Speaker. All right. Senator Morrison, and then Senator Uggan.
Thank you, Madam Chair. I appreciate the questions and the answers. I think a lot of my colleagues were looking for more specifics on that, and I appreciate my speaker's questions. Madam Chair, I just want to point this question. I mean, I know there's been a lot of emotions being played out there, and I think it's very, very. I think it's very appropriate to ask this question with regards to the hospitals, but and knowing that we are to go into deliberations after this regarding Bill 245 and possible amendments, potential amendments, what are the consequences of GMH not getting a dedicated funding source? And what are the payables at this time? And is the hospital facing a potential payless paydays? I mean, these are things that I know run on our minds, and we're hearing we need a dedicated funding source, but is that relative to issues regards to payables or potential payless payday?
Well, Senator, the hospital has been challenged daily, and we are on credit holds with certain vendors, and these are vendors that provide the hospital supplies, equipment or services, and it has been difficult also in oftentimes meeting retirement fund, the contribution. We have been late, and whenever we can scrunch up enough money, we pay, but it does impact retirees, potential retirees, that employees that want to retire, and it does impact the services that the hospital can provide. If push comes to shove, we have to look at cutting back beds, and cutting down ICU beds, cutting down telemetry, just a lot of the services that are needed daily. And what that's gonna mean is, the hospital will be on divert, meaning that they will go to GRMC. Right now, when GRMC is in full capacity, they're also on divert, and sometimes it doesn't necessarily mean that they have 130 patients. They look at their staffing, and when they don't have enough staff, they cut down the number of beds that they can use, because you need nurses to staff those beds, and that's what the hospital has done too. So we have scrutinized purchases and try to prioritize and just approve those life-saving purchases. But even with that, some vendors don't even honor our purchase order because we have outstanding payables to them, and that is very difficult.
Senator Morrison, did that answer your question?
Yes, Madam Chair. I just want to make sure that our public heard, exactly, what challenges could potentially be without a dedicated funding source to the hospital, and what's pointed out in Bill 1245 is a dedicated funding source. Now, this is to Mr. Carson or DOA. I know the bill as written, should it pass, it's broken down here. 0.75 would go to the Guam Memorial Hospital, 0.25% will go to the Department of Education, and 1% will go to the General Fund Government of Guam to address the tax base resulting in the passage of the tax cuts. Now, should this be reduced to 1%? How would this be adjusted? How would this be adjusted? I know it'll be up to this body, but is there any? Would it just strike out the 0.75 to the hospital and keep the 0.25 to DOE, or would it be reapportioned? That 1% be apportioned? I'm just bringing this up in the case of scenario of an amendment that might take place.
Are you asking for a suggestion from one of the panel?
Yes, Madam Chair. I just want to make sure that that's clarified. If there's, should that happen, I know this is the governor's bill. The administration's been providing testimony in support of this measure, but again, I just want to be open about, should an amendment occur and it reduces to 1%, how would this section, the use of appropriation of the revenue, be apportioned?
Senator Morrison, I know that you just reiterated our full support for the bill as introduced and as before the body today. I would not even consider anything but the full 2%. So as far as contributing to any revisions, not only do I strongly urge this body not to go there, I don't think it's right that we even participate in that good discussion.
Right. Senator Morrison, is it all right if I ask Senator Uggan? Did you have a follow-up question to one of these, Senator Uggan? Senator Uggan? Did you have a follow-up to one of these questions?
General question.
Did you have a follow-up, or did you want to...
I have some general questions I'd like to pose to the panel.
All right, then let me let Senator Morrison finish.
Thank you.
Please proceed.
Madam Chair, I'll come back. Allow my colleagues to.
Senator Uggan, you're recognized.
Thank you very much, Madam Chair, and good afternoon, folks. Thank you for joining us this afternoon. I'd like to go back and revisit the number that the Speaker, the Chair of Appropriations, had alluded to with the CRER report. And he said that the report reflected a $36 million reduction in revenues by the close of the fiscal year. So that's going to be my starting point in terms of looking at the anticipated reduction in funds. The administration had come up with a $15 million figure that said cost reductions can be identified in the amount of approximately $15 million. So if...
Senator, I'm sorry.
Yes.
Could we get a copy of the CRER? The panel doesn't have a copy. They'd like to see one before they answer your question.
Madam Chair, did you want to take a recess?
Yes, let's take a 1 minute
we
recess.
all get a copy.
Thank you.